Today we're going to the district health office for the district of Mubende. One of the roles of Imaging the World Africa is an implementation of an integrated system of care. When we go into a community and establish an ultrasound program at an existing clinic, we have to help the community to understand why we're there and work with the cultural beliefs and the socioeconomic status of the community.
We've achieved this by training local practitioners who not only examine patients using this ultrasound technology, but also act as ambassadors for the project as a whole.
So when we first came to Uganda and we were talking about setting up the program there, one of the community leaders met with us and said, we have many organizations that come and many organizations that go. What we really need is an organization that will come and stay and be with us. And that's exactly what we were looking for. We were looking for a place to go where it was going to be owned by the community and owned by the local healthcare workers and owned by Uganda.
My name is Alphonse and I'm a consultant surgeon at the Mubende Regional Referral Hospital. Imaging the World has supported the local community to start ultrasound imaging. But the scanning is not only limited to pregnant mothers. A number of other patients with healthcare conditions have been able to access this ultrasound, and in that way they can get a good diagnosis and treatment.
Imaging the World is taking care of a very underserved population. The system was originally designed for prenatal and neonatal care. Now we're seeing it's possible to diagnose a host of other medical conditions, such as cancer and infectious diseases, with the ultrasound system that's currently in place.
I have worked in a rural Uganda since I qualified as a medical doctor, and I have shared the suffering of our people. I have seen mothers dying at the hospital gate because they delayed to come in labor, where even as a surgeon I cannot do much.
Nze najja mu ddwaliro nga olubuto nga ndowooza nti lwafiiramu kuba lwali terulina sayini yonna eraga nti lulamu. Bwe bannatuuka wano ne banteeka mu sikaani ne tusanga omwana mulamu.
Tuli bakyalo tubeera mu kyalo eno teri mmotoka nnyingi talisobodde kutambula mu ttawo naye nga sirina kyakukola nabadde ngenda kubeerawo.
The problem before was that these are really remote communities with poor transport and access to the big hospital. Imaging the World has given them an opportunity near their homes within a local health facility, and now with the availability of ultrasound, it is easy to save the mothers and also to save the babies.
When we first came to Uganda, ultrasound really was pretty clunky. We actually started by having a relatively large ultrasound machine that we parked beneath 2 Land Rovers with a tarp over the top, and we ran it off of a large generator. But over the course of time, technology has really changed and has really opened up possibilities for a program like this. In addition to the technology, which turns out is only about 5% of a successful program, you need to have education at multiple levels, educating the nurses and clinical officers, educating the community, educating the local healthcare workers, educating the policymakers.
With adequate training, which is occurring here, it's relatively easy to use. And the great ability of local practitioners and midwives and so forth to learn how to do this is happening here, and it's critical to the process.
We've trained over 120 healthcare workers in Uganda to do ultrasound, but over time we've seen a lot of the people that we've trained to do ultrasound want to further advance their careers and have gone on to get sonography degrees. And a couple of our original trainees have actually gone on to medical school.
When you see a woman who is higher, it inspires you. Like Dr. Christine inspires me. Seeing a woman develop and grow things that men are doing, it influences other women.
I love what I do. I mean, this was a new experience that I signed up for, and it feels amazing if you have to really help someone who cannot help themselves and you see that you can save a life. Yeah, it feels amazing.
And I would love one day to also be called Dr. Sharon and do good work to the community. It is a nice thing to see a woman grow up.
What we noticed when we put ultrasound into the rural clinics was essentially a magnet effect, that with the ultrasound there integrated into the antenatal care and the prenatal visits, that women started coming more and more. And to be able to have the husband and wife together, to be able to talk to them about what's going on inside the bodies of their wives, we had an opportunity to test and treat them for so many other things.
Previously, men used not to involve themselves in coming for antenatal and other things, but now you can see there is an increase of men escorting their women to the antenatal care. Not only for ultrasound, but even testing, we capture them, at least they are tested for HIV. We encourage them to test for these other things like blood group, immunizing them for tetanus and also for their children. So they have now known. Creating awareness to the community has increased also.
There are huge barriers to care for women with potential breast cancer in Uganda. We have a cytopathologist with us on the trip who's here to study breast cancer diagnosis at the village level.
Basically, you put in a needle into that growth, take out some cells, and smear them on a slide, quickly stain them, and look at them under the microscope. Just modify that. It's possible to make a diagnosis, cancer, no cancer. We are going to build on what the Imaging the World has succeeded. My hope is actually, if it works here, that it doesn't stay in one place. Once you have the procedures in place, then you can expand to the places where Imaging the World is working already and even further.
The Imaging the World Africa team is incredible. This is a group of individuals that have dedicated their lives to this project. This is people from all different sides of Uganda. This is healthcare workers. This is people from different backgrounds who really support the program on the logistics side, on the IT side, on the coordination side, on the administrative side. We would not be able to do this project without them.
Imaging the World is creating an integrated, low-cost, scalable and enduring answer to some of the world's most dire healthcare problems. With further funding and donation of ultrasound equipment, this program and Imaging the World can continue to go from strength to strength.